Mental health is just as important as physical health. Governor Snyder issued an executive order last February to find solutions to improve mental illness. How are we doing as a state when it comes to supporting the mental health initiatives here in Michigan? Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Joining me now is the President and CEO of the Detroit-Wayne Mental Health Authority, Tom Watkins. Thank you so much for joining us today.
It's great to be with you. Thank you.
How are we doing as a state? Because we hear so often that the mental health initiatives are underfunded and there's not enough resources available for those suffering from mental illness. But are we doing any better or are we doing okay?
We're good and getting better. We need to focus like a laser every single day on maximizing the resources that are in front of us. We receive over $640 million in Detroit-Wayne County to meet the needs of people with serious mental illness, developmental disabilities, and substance use disorders. It sounds like a lot of money, but when you're providing high quality care to people 24/7, it gets stretched very quickly. But we're focused on doing the right thing for the people of this community.
This mental health authority that you are now heading up has made the transition and is almost completely transitioned away from being under the umbrella of Wayne County. Is that going to help? Will that allow you to offer services more efficiently and better services?
It will. Other communities throughout the states have moved to an authority status long ago, pulling away from the county. And what this enables us to do is to truly focus on the issues that are in front of us, that we're not tied up with the other services within the county, running the jails, the road, and the like. So it enables us to truly focus. We have a tremendous community board, 12 men and women some that have suffered from mental illness in the past that sit on our board, other community leaders that really add value and help make a difference in the lives of people we care for.
What does this change really mean to the people of Wayne County? If you have a sister, a brother, a mother, a friend who is suffering from mental illness in the past, perhaps, who knows what the changes will be with the Affordable Care Act, but I know previously it was difficult oftentimes to get mental health care covered by insurance companies. It was difficult to afford. You didn't know where to turn. What would you say to people in Wayne County who are either suffering from or know somebody who is suffering from mental illness?
I would encourage them to reach out to us. We have some excellent service providers throughout the community that are standing ready, willing to help. Are there waiting lists at times? Yeah, there is. But we're focused like a laser on assuring that we provide the highest quality care. Our board has asked that we focus on the consumer-focused, community-focused, data-driven, and evidence-based, the best practices we humanly can put in front of people to assure that we're maximizing the level of care, treatment, and recovery for people with serious mental illness, and to provide quality care for people that are developmentally disabled.
There is some legislation currently working its way through Lansing when it comes to mental illness that would do what?
Well, there's two pieces that are going on. At the state level, the governor has appointed a commission with Brian Calley as the chair, the lieutenant governor, Jim Haveman, the director of the Department of Community Health, and they're going to be putting forth some recommendation. They've done a listen and learn tour, if you will, talking to parents, people with mental illness, developmental disabilities, and the like across the state, and they're going to fashion some recommendations, and we're very pleased with that process. The second is Debbie Stabenow, our U.S. Senator, is pushing for Excellence in Mental Health Act. And what this would do is bring additional resources to community mental health agencies across the state in order to provide just as important care from the neck up as we do from a physical health side from the neck down. And we really commend Senator Stabenow for this effort.
You mentioned earlier that substance abuse now would be brought under the umbrella and integrated into the treatment. This was not done in the past. Is this a significant change?
It is a significant change because, again, you can imagine people with serious mental illness in particular come to us, and they come to us with their full self, and oftentimes through self-medication, street drugs, alcoholism, and the like, that they're co-occurring disorders. They're happening at the same time. And this will bring the resources together so that we can treat the entire person and not just the mental health side of the issue and then send them over to a substance abuse agency. And ultimately, it'll truly benefit the care of people throughout the community.
How big of a piece of the puzzle is destigmatizing mental health? Because people who are suffering from it or know someone who is oftentimes don't want to talk about it, don't get help because they're embarrassed or afraid.
Well, we don't blame somebody because they've had a heart attack or they have cancer or some other physical ailment, and we shouldn't be blaming people if they're suffering from serious depression, schizophrenia, manic depression, autism, any of the other disabilities that are out there. These are diseases and they need to be treated in the same way to provide the care, treatment, and with the appropriate diagnosis and treatment, people can go and live very productive lives on a life of recovery. And so we need to encourage people that have issues, whether it's depression or schizophrenia, have the like, to reach out or have their family members reach out. And we as a society have to take a step back and remember that that person suffering is somebody's mother, father, sister, brother that deserves the highest quality of care and treatment that we can afford to provide them.
All right, well said. Thank you so much. We will continue our conversation with Tom Watkins in just a minute, talk about peer support, how important that is to folks suffering from mental illness, and also touch as well on what we can do to better serve our veterans. We'll be right back.
Oh, look, Bill. AT&T has the same old DSL internet speeds.
Good, because Xfinity is way too
fast. Oh, my. Bill Jr. just used the F word.
Where did he learn that? Ow! Fast! What the fast? You're fasting kidding me. We should be more careful.
Oh, we should.
Me should be. Me careful.
Go way faster than AT&T. Awesome is having the fastest internet, and now the fastest in-home Wi-Fi from Xfinity.
The Detroit Wayne Mental Health Authority is one of the nation's largest county mental health organizations with more than 100 employees and a budget of $640 million. We're back with the president and CEO of the Detroit Wayne Mental Health Authority, Tom Watkins. Thank you again for sticking with us today, talking about mental illness, how we're doing here in Michigan to serve those specifically in metropolitan Detroit, using and trying to use more some things that you're hoping will help aid those with mental illness, specifically as somebody's going through the road to recovery, not just implementing psychologists and psychiatrists, but using peer support and trying to get those folks together that might be able to help one another.
It's very important, this peer-to-peer, people that have been there, that have traveled the road to recovery, to interact with each other. So we've established that, whether it's clubhouses where they can get together and share their experience. We've also had the opportunity to hire people that have come and work in the system, because mental illness comes to us in all shapes, sizes, colors, religions, background, socioeconomic status, and professions. And there's a lot of opportunity where we can use the skills of people that have traveled this road before. So we hire people that have had a mental illness in the past to work with us in our customer service division, and work with a lot of the provider agencies across the community.
I would imagine with the stigma that still is attached to mental illness, that it's often a lonely disease, that you feel as though you may be the only one suffering, and that this peer support can be quite key.
Absolutely, and again, we need to engage the psychiatrists, psychologists, social workers, and other helping professions in the process. But the peer-to-peer opportunity is another very important component on that road to recovery.
What about research? Is it your authority's job to do research, or simply to take research, to fund research? And how much do we still have to learn when it comes to how our brains work?
Well, we are a consumer community-focused organization that's data-driven and evidence-based. And that evidence, those best practices, oftentimes comes out of our great universities. 3 major research universities here in the state of Michigan, Michigan State, U of M, and Wayne State University. And we constantly partner with them to see what are the best practices that are coming down the pike, whether it's in medication or treatment modalities. And we can reach out and tap into some Medicaid research dollars that are coming from the federal government to partner with those universities in order to assure that we're on the cutting edge here in the community, to assure that we're providing the highest possible quality of care to the people that need it.
How fortunate are we, or do we even realize how fortunate we are to have leading universities, research universities, really like this right in our own backyard?
There's some of the best universities around the world in our backyard, and we need to and are working in ways to collaborate with them to assure that we're doing the best that we humanly can.
What are we doing, if anything, special is not the right word, but significantly different to serve, in particular, our veterans? And do veterans make up a significant portion of the mentally ill?
Well, we owe it to people with mental illness to provide the highest quality care. And if there's a specialty, if you will, or a special place, and that is for our men and women that have served in the armed services that are coming home, perhaps have lost a limb, have post-traumatic stress disorders, the like. Some of the things within the mental health field are not as visible, but we owe it to them. And so we're partnering with the Veterans Administration and the like to assure that we get the care that they need and deserve so they can go on and live very productive lives.
Have the recent tragedies, the gun violence that have really made headlines and created controversy, is it a gun problem? Is it a mental health problem? Have those types of major stories and tragedies helped at all to put a spotlight on mental illness and perhaps put more focus or more funding into helping the mentally ill?
Well, it certainly has created a focus because there's been a couple of certainly in the Newtown tragedy that we just passed the recent anniversary of that tragic event in Washington, D.C., where we saw a person who had a history of mental health issues go and shoot up and kill 12 people. But we need to point out that people that are mentally ill are more likely to be a victim of crime than a perpetrator of crime. So it's highlighted the issue, in some ways stigmatized it greater, but what we need to do is assure that people with a serious mental illness are diagnosed, provided the treatment, and then helped along the road to the recovery. And when we put the resources behind those individuals and get them, it's really an investment in all of us. It's an investment in quality care for all of our communities across this great state and this great nation of ours.
While the authority that you lead is one of the largest in the country, certainly has a multi-million-dollar budget, you can't do it alone. I know that you rely on collaborating with many other small nonprofits as well as other county organizations.
Absolutely. You're absolutely right. We can't do it alone. We need parents through the National Alliance of Mentally Ill, NAMI, parent organization, the Association of Retarded Citizens, the United Way, many partners throughout the community to wrap our arms around finding ways to maximize the resources to provide the highest quality of care we humanly can to some of the society's most vulnerable individuals. And that's people with developmental disabilities, people with serious mental illness, and persons that are abusing substances. We have a responsibility, and we take that responsibility very highly in Detroit, Wayne County, to maximize resources to benefit the people within our communities.
What are you looking at or following, if anything, on the federal level that could impact us here in Michigan?
Well, we're constantly looking at the legislation, getting the budget passed and putting research dollars into mental health areas. The Medicaid, the Affordable Care Act, we commend the President for passing this, and Governor Snyder for expanding Medicaid use here in the state of Michigan. That will mean over 400,000 people, nearly 500,000 people, will get the care that they need throughout the state of Michigan.
All right, thank you so much for joining us today. Tom Watkins, thank you.
Good to be with you.
Coming up next, we will meet with the Executive Director of the Oakland County Community Mental Health Authority, Jeff Brown. He will be joining us. We'll be right back.
Just see the season finale?
I forgot to DVR it.
Don't sweat it. You can just catch up on demand.
I can't do that with satellite.
Well, with Xfinity On Demand, all the latest episodes are right there for you. Am I right, Terry?
Time to man up.
I'm ready to man up. Hey, dude.
You talking to me, dude?
No. He's talking to Terry.
Time to man up.
Listen to Terry.
Awesome is catching up on the latest shows from the top 4 networks with Xfinity.
Sign up for a great offer today. Call 1-800-XFINITY.
The Oakland County Community Mental Health Authority leads a provider service network that assists more than 22,000 Oakland County citizens, as well as manages a $300 million budget. This budget provides funding for more than 300 service sites and employs approximately 4,000 people. Hello and welcome back. I'm Laurel Hess and this is Comcast Newsmakers. Joining me now is the Executive Director of the Oakland County Community Mental Health Authority, Jeff Brown. Thank you so much for joining us today.
Lauren, thanks for having me.
Some exciting news, a good time when it comes to mental health in Oakland County. You have recently opened a brand new resource and crisis center to do what? Where is it? What is it? And how will this help to provide services to those in Oakland County?
Oh, you bet. A very exciting time. In fact, 2013 was our 50th anniversary. And we've answered President Kennedy's charge to do whatever, by all means, and the best of your ability to connect, improve the lives of people with mental health, and linking that with, physical health. We have created, with our partners at Oakland County, a resource and crisis center on the Oakland County campus. We renovated one of their buildings. So for our next 50 years, we wanted to make sure that we left a footprint, a place where people would know throughout Oakland County to either call or to come, where they could come and get, if they're having difficulties, to have a place to come where we could help them and sort that out and move forward.
And you're not necessarily a direct service provider, but work with a lot of different nonprofits and also government agencies to lead folks in the right direction, get them the help they need via whatever might be the best resource.
Absolutely. That in 2000, that our board and our county chose to become an authority, and also chose at the time not to provide direct services. As such, that we know that our people need to live lives in the community, and as such, connecting with government agencies. And we have a big provider, network of nonprofit organizations that have been around providing services, for years in Oakland County and are very expert. We write the contracts and work with them to make sure that our county is served effectively and efficiently for all those needing mental health services. And those are people with developmental disabilities, adults and kids with mental illness, people with substance use disorders also.
I heard you say we know that our clients need to live their lives within the community. And I know you're very proud of sort of leading the charge, if you will, to de-institutionalize those with mental illness, because that used to be where people with mental illness were, in institutions, and now they are out living among us, and it is our duty to make sure that they're healthy and living among us.
Without question, and it is a source of pride, and a couple of pieces that there is no state institution for people with developmental disabilities. Both of our organizations that serve people with developmental disabilities, Macomb Oakland Regional Center, or MORC, or Community Living Services of Oakland County, have led the charge, and to be able to have people come out of the institutions and live lives in the community. That has been what we've done not only on the side of serving people with developmental disabilities, but we focus in on also those with mental illness to make sure that when there's hospitalization that's needed, it is there, and when they are able to return to the community, that we do that very quickly and very effectively, and so that they can live, work, play in the community as citizens.
With that said, we want to make sure that because mental illness can be a very lonely disease, it can be very stigmatized, that those folks have access to others, to peers that are perhaps going through the same types of issues that they are. How important is that peer-to-peer support, that ability to get people together who are going through the same types of experiences?
Well, I speak from my experience as a cancer survivor and what it took for me to recover. Not only good docs, but it really was the peers, someone who has been there and done that, and so would tell me how to walk through the trials that I was having. There's nothing worse than suffering in silence, and that is what epitomizes many of those folks with mental illness, that it has been stigmatized in such a fashion internally for themselves, but also in our community, that people are afraid to talk about it. And we know that the more connected that you are in your community, more connected you are with people, the more healthy you are, the more healthy and the longer you live.
What do we do? What do you say to people? Do we need a big PR campaign to help folks who are not suffering from mental illness understand that it is on par with having a physical illness?
Mm-hmm. Well, what I found is that so many people are touched by mental illness. They may not have it, but a family member does. And sometimes it's just not anybody's comfortable of talking about it. But when you do, you find out more of what you how you can help and that you are connected and understanding. One of the bills and one of the things that has come recently is mental health first aid. It educates, it informs, and it also tells people what they can do as private citizens to help someone when they know that someone is in need.
All right, we'll talk more about that in just a minute. Thank you so much. Stick with us. We'll be right back, talk more about mental illness, how it relates to physical health, and how we can better remove the stigma. Stick with us.
Oh, look, Bill. AT&T has the same old DSL internet speeds.
Good, because Xfinity is way too
fast. Oh, my. Bill Jr. just used the F word.
Where did he learn that? Ow! Fast! What the fast? You're fasting kidding me. We should be more careful.
Oh, we should.
Me should be. Me careful.
Go way faster than AT&T. Awesome is having the fastest internet, and now the fastest in-home Wi-Fi from Xfinity.
Welcome back. Again, we are here talking with Jeff Brown, the Executive Director of the Oakland County Community Mental Health Authority, talking about some major initiatives that you have going on right now. One, to remove some of the stigma attached to mental illness. And I know another big initiative right now is trying to educate physicians, MDs, and others about the connection between mental health and physical health, which many of us don't really realize exists.
Mm-hmm. I think starting with the latter, that mental health and physical health are You can't talk about one with the other. And that is what we're starting to realize, that mental health has always been sort of excluded, been separate, but it really affects any of the health. And that's what really is the genesis for the anti-stigma programs. We need people to understand when they're hurting in their mental health that it is something not only to recognize but to talk about, then to understand how that connects into their health, and then be able to make some changes. And without that recognition and the comfort to change, you're not going to change. If you're keeping it hidden, it'll never be there.
I would imagine as long as we're talking about mental health, physical health, you can broaden that economic health. If you're not mentally stable, there's a whole lot of things in your lives that aren't going right.
Yeah, it all tends to build on each other. That the connection between mental health and blood pressure, stress levels, and the folks with mental illness die 25 years earlier than the average citizen. There's tons of reasons, smoking, you name it. And it's important that once we want to make sure that folks live inclusive lives with as others, that we attack some of the variances between what they have for mental illness and the population who doesn't have. We need to improve that.
Is part of that going right to the core of educating physicians, MDs, when you walk into your doctor's office and you mentioned something interesting and you have high blood pressure and you have a high amount of stress, and the doctor gives you a prescription or tells you to lose a little weight, but doesn't ask what's causing the stress. Do you have some anxiety issues, and perhaps refers you then to a psychologist, a psychiatrist, somebody who can deal with what's causing the physical problems?
Mm-hmm. Yeah, or just give an information and have you walk out the door and knowing that you're going to be 10 pounds heavier when you come back in. I think it's education for everybody. We are really working hard to integrate the healthcare so that people who are working with us on the mental health side also with their primary care physician. Earlier intervention is the best. You can't neglect it. You hit issues early, you have a better chance of changing. And that does create education opportunities for physicians and as well as the mental health. And that's some of the big initiatives, is to connecting us at the statewide level these coming years.
How do you know where to go, where to turn? Because reality is there is that stigma. We have social media today, and people will say, I need a recommendation for a good pediatrician. Does anybody know anything? But you're never going to see somebody who says, I need a good recommendation for someone who can help with my schizophrenia. So until that day comes, where does somebody who is suffering in silence, who is afraid to say something, where do they turn when they pick up the phone, when they wander out their door and they say, today's the day I need help? Who do they go to?
In Oakland County, that's exactly where we want people with those questions to call the Resource and Crisis Center. If they don't call, they can walk in and to be able to get that information. You and I, we ask family, we ask friends. And if that would be also another way, if you were able to then talk about your mental illness and then where to get help. Without that, they need to be able to come, and that is the resource that we want to make sure our community knows that they can come, and there is hope for the issue that they have, and we'll connect them into the community.
And of course, they need to know that whatever they do, say, go, that's kept completely confidential, and there are some low-cost options as well, because that's a concern.
Absolutely, and I think cost of all of this, we're in the process of redefining and refinancing how healthcare is being provided. But we are the low cost, we have sliding scales and no cost for people. It's important for us to understand when people have something that they need, an issue to have, a place to call.
All right, thank you so much for joining us today. I appreciate your time.
Thank you.
For more information on today's topic, you can head to the State of Michigan website, which is michigan.gov/MDCH. I'd like to thank all of our guests who joined us today, and thank you as well for watching this special edition of Comcast Newsmakers.